ICD-10-CM stands for the International Classification of Diseases Clinical Modification in the 10th edition. The International Classification of Diseases, ICD, actually goes back to the early 1900s. It was developed and maintained through the World Health Organization primarily as a way to classify mortality and provide data to evaluate trends of mortality across the world and look at what types of conditions patients would have based on where they were living. In the United States, we have the clinical modification, and this is the version that's developed for use and maintained by the National Center for Vital Statistics. The 10th edition was implemented in the U.S. on October 1st, 2015, and replacing ICD-9-CM. This system is publicly available through download from the CMS website, but end users may not alter the structure, conventions, or guidelines of the code set. Maintenance for ICD-10-CM is done through the ICD-10 Coordination and Maintenance Committee. Meetings are held during March and September each year, open to interested parties either in person or via the web. The final updates for each fiscal year are published in the Federal Register in early August. Changes through the maintenance process can include adding new codes, revising descriptions, updating guidelines and conventions, fixing errors in indexing, and again inactivating codes. This is generally done when new codes are added that have more specificity to replace the existing codes. For example, ICD-10 has a number of codes for laterality, for right or left. If we find a condition that was missed in the original version of ICD-10 that does have a right or left component, they can retire the current code that doesn't specify laterality and add new codes for right, left, bilateral, or unspecified. The annual update is effective with October 1st. ICD-10-CM is used in a number of places. It facilitates payment for health services, can evaluate utilization patterns, and study appropriateness of healthcare costs. It's also used to indicate medical necessity for a patient encounter when submitting healthcare claims. This is regardless of the provider setting. So whether the provider is in an inpatient, physician office, home health, long-term care, other type of setting, ICD-10 would always be used as a diagnosis code to identify medical necessity for the claims. It's also an important component of many quality measures to identify patient populations or specify diagnoses or conditions. For example, it can be used to include patients in a measure looking at diagnoses with patients with an acute myocardial infarction. It can also exclude patients in other measures with a current cancer diagnosis where that would make them exempt from the measure. Structure of ICD-10 is a code that can be from 3 to 7 characters in length based on the need for additional specificity. Some examples, for example, the first one, I-10, identifies essential hypertension. It's only a 3-character code because it doesn't need additional specificity. We can go to the fourth one down, S72.001A. This is an injury code. So it's identifying a fracture of the unspecified part of the neck of the right femur, and it's also identifying that this was initial encounter for closed fracture. So because of the complexity of this diagnosis code, it requires as the full 7th characters in length for this structure. Codes are organized into chapters by major body system or type of condition. As an example, we have digestive chapter, respiratory chapter, and we also have infectious disease or neoplasms as examples of the type of condition for the organization of this structure. There are 2 chapters that are also designed to capture additional information beyond specific diagnoses. One is a chapter called Factors Influencing Health Status and Contact with the Health System, generally referred to as the Z-code chapter. In there, we have codes to identify a personal or family history of specific conditions, such as a heart attack or cancer. It'll also identify patients have encounters for examination or screening that may not result in a diagnosis, such as a well baby exam or a pre-procedural exam for patients undergoing surgery at a later date. allergy testing, or supervision of a normal pregnancy where there's no associated complications or risks for the mom. It also has codes for socioeconomic or psychosocial factors that may affect health status, such as the unavailability of schooling, the threat of a job loss, or occupational exposure to noise. And finally, it has other health status factors that identify an allergy status, an amputation status, whether the patient has had implants of some type, on dialysis, or they're currently on a ventilator. The other chapter that provides additional information or supplementary information is the external cause of morbidity. These codes begin with a V through a Y. This identifies causes of injuries. So it would include things like accidents. How did the accident happen? Was it a transportation accident, a fall, contact with machinery? Was it something that happened in the military, or was it a result of terrorism? It also will identify in certain circumstances whether the injury was self-harm versus an assault. And it will identify complications from medical or surgical care. There are also other factors in this chapter that will help to evaluate injuries. One is the place of occurrence. Did it occur at home? Did it occur in a nursing home? Or what kind of activity were you doing? As the example below, the patient broke their arm slipping on a wet floor in a restaurant while working. So the broken arm is actually a diagnosis code, but how it happened and where it happened, the slipping on a wet floor in a restaurant, are types of external causes that can additionally be coded. ICD-10 also has very extensive guidelines governing the use of the code system. There are general as well as chapter-specific guidelines that provide instructions, definitions, and sequencing information for the order of the codes assigned. Examples of ICD-10 codes for social risk factors can include things like a Z code, Z59-4, indicating lack of food and adequate drinking water, or an E code, which is from the endocrine system, identifying an unspecified nutritional deficiency, or Z59 that would indicate that this patient was homeless.